Welcome to the broadcast, continuing our conversations from Aspen. Tonight, two of the pioneers in the field of mind-body medicine. First, cardiologist Dean Ornish talks about revolutionizing the way we treat heart disease and other illnesses.
Yeah, what we've been able to show is that these very simple choices that people make in their daily lives, like what they eat, how they respond to stress, whether they smoke, how much exercise they get, and the quality of their relationships, really play a much more powerful determinant in their health and their well-being than anything that I or any other doctor can do for them. And I think it really gives many people new hope and new choices that they didn't have before.
And then a remarkable woman, Dr. Rachel Remen, a doctor and an author, on redefining the way medicine is practiced today.
It's not about healing disease. It's deeper than that. It's a way of life. I happen to see it as a philosophy, and I think it's a spiritual philosophy. That's why perhaps we call it a practice, you know? And I see it as a way of life that's characterized at its best by compassion and harmlessness, service, reverence for life. You know, these aren't the qualities necessarily of a scientist. It's a different way of life than that.
A discussion about mind-body medicine next.
7 out of 10 students on the web say they're getting better grades.
Are you ready?
Virtually all internet traffic travels across the systems of one company, Cisco Systems, empowering the internet generation.
Funding for Charlie Rose is made possible by Amazon.com, your online source for everything from books, music, and toys to videos, electronics, and tools.
Brought to you by the new Toyota Prius. Part gas, part electric. Nature should definitely approve.
Charlie Rose is also made possible by these funders.
And by Bloomberg, a provider of multimedia news and information services worldwide.
Dr. Dean Ornish first gained public prominence with the 1990 publication of his groundbreaking book about heart disease. His radical theory was that the progress of heart disease can be reversed by changing diet and lifestyle, and without drugs and without surgery. Now, 10 years later, his program is being run by dozens of hospitals and being paid for by insurance companies and in some cases Medicare. More recently, he has proposed some new theories about illness and lifestyle. In 1998, in his book Love and Survival, he wrote about the power of love and intimacy to treat heart disease. Most recently, he has launched studies examining whether lifestyle changes also work in reversing prostate cancer. I'm pleased to have Dr. Ornish back on the program, and especially have him here in Aspen, Colorado. Welcome.
Thanks, Charlie. It's good to be here.
Let me go back and then come forward. I mean, almost to what you're saying about love and intimacy and what you were saying about prostate cancer, and try to find some line of continuity. What was the life work about when you first started this thing? Tell me where your ideas were, the philosophy, you know, the goals, what you hope to do.
Well, I guess for the past 25 years, my colleagues and I at the nonprofit Preventive Medicine Research Institute have conducted a series of studies that demonstrated that you can actually reverse the progression of serious illnesses like heart disease, and much more quickly than we had once realized, if people are willing to address the underlying causes of why people get illnesses like heart disease, rather than just literally or figuratively bypassing them. And that has been really the underlying theme of all of my work, which is to treat the cause of the problem rather than just bypassing it. And we use these very high-tech, expensive, state-of-the-art measures to prove how powerful these very simple and ancient and low-cost interventions can be. You know, we often think it has to be a new drug or a new laser or something really high-tech and expensive to be powerful. And yet what we've been able to show is that these very simple choices that people make in their daily lives, like what they eat, how they respond to stress, whether they smoke, how much exercise they get, and the quality of their relationships really play a much more powerful determinant in their health and their well-being than anything that I or any other doctor can do for them. And I think it really gives many people new hope and new choices that they didn't have before.
Give me a sense of the evolution when you started 10 years ago and today. Because when you step forward to do an experiment in a hospital, taking people with prostate cancer who are not prepared to go at that point into other therapies and say, I want you to try this kind of reduction in stress, change in diet, and I perhaps have a theory that will eliminate this prostate cancer, a lot of people pay attention because prostate cancer has gotten a lot of prominence in America. How have you gotten from where you were to where you are now?
Well, we weren't doing studies, whether heart disease or prostate cancer, to prove that it was reversible. I'm a scientist, and I just felt whatever we showed, it would be useful. If we showed it did nothing, then that would be important because, you know, a lot of people have been making changes in diet and lifestyle in hopes that it could reverse heart disease or more recently prostate cancer without anyone really knowing one way or the other. So I figured whatever we showed, it would be useful. Now, 25 years ago when I did my first study in 1977, I was a second-year medical student. And one of the nice things about being a medical student is that they cut you a lot of slack, and they, you know, my advisors then said, well, you know, it's a kind of a dumb idea, but you'll learn something, and so we'll support it. And they did. And so through the generosity of some people in Texas at the time and later in other places, we were able to show, first in a pilot study of 10 patients and later in a randomized trial just a month long, and then after that a randomized trial that was a year long, and then we got NIH funding to extend it to 5 years, that using quantitative arteriography and cardiac PET scans and other measures, that people actually could get better instead of getting worse and worse, which at the time, you know, at the time they said if you have heart disease, you're going to get worse and worse. You may be able, at best, to slow down the rate at which you get worse, but that's about it. What we're able to show is that you could actually, instead of getting worse and worse, you could often get better and better, and much more quickly than people had realized. Now, that idea, which was radical at the time, has become mainstream. The criticism of our work now is, yeah, we believe it's true, but nobody can do it. And so then the next series of studies were designed to say, how practical is this? We know it's medically effective. Can people do it? You know, not just, you know, people say, well, you know, you live in California, it's an altered state, you know, they'll do anything there. You know, this will never play in Peoria. So through our nonprofit institute, we began training in sites around the country, and more recently with a company called Lifestyle Advantage, which is part of Blue Cross Blue Shield, to say, could we train other hospitals to do this and other sites? Could they motivate patients in places like Omaha or Des Moines or Columbia, South Carolina, where they told me gravy is a beverage, this will be a big change in our lifestyle. You know? Can we get people there to do it as well as people in San Francisco, and can other people do it as well as your group? And what we found is that they could, that while this isn't for everyone, people who thought they could change, in most cases, were able to do so. The insurance companies found, Mutual of Omaha was the first, but there are over 40 that are now paying for it, and as you mentioned, Medicare is now paying for 1,800 patients to go through it. And they found that they were saving, Mutual of Omaha found they saved almost $30,000 a patient. It became an alternative treatment and not just prevention. Traditionally, insurance companies have been very reluctant to pay for diet and lifestyle because they viewed it as prevention. And they'd say, why should we spend our money today for some future benefit that even if it occurs, someone else is going to get because 30% of people change insurance companies every year? We reframed that by saying, this isn't just prevention, it's an alternative treatment. And for every man or woman who would have undergone, say, bypass surgery, who can avoid it by changing diet and lifestyle, then you save $30,000 immediately. You know, real dollars today, not just theoretical dollars years down the road. Their skepticism was they didn't think people could do it. And what we showed is that most people who thought they could do it, given the proper support, were able to.
The acceptance of diet and exercise and a reduction of stress as a process of reducing the likelihood and the risk of heart disease, and even reducing heart disease, has been accepted by the medical community.
That's correct. But what they don't accept is that people can do it. And they also, we don't have the training to do it, we don't have the reimbursement to do it, and because of managed care, we don't have the time to do it. If you have to see a new patient every 7 minutes, Charlie, you don't have time to talk about diet and lifestyle and the kid on drugs and the problems in the marriage and the problems at work. You basically have time to listen to the heart and lungs, write a progress note, write a prescription for a statin drug, and you're off to the next patient.
That's our next show with Rachel Remen. We'll get to that in just a moment,
okay.
in terms of how physicians show compassion and time and involved in the process of healing. Let me just stay with heart disease and the reduction of heart disease. So here you are with a diet. You know, there are other diets out there. I mean, there's constant conversation about drugs. You know, lots of cholesterol reduction drugs are getting lots of attention and lots of praise for their results. Okay. How do you know what's best for you? Ornish, Atkins, some anti-cholesterol drugs that are getting a lot of attention. Give me some sense of how an individual weighs these choices.
Good question. The reason I'm a scientist is that I believe in the power of science to help people sort out these very kinds of conflicting claims that you're talking about. You know, Ornish says one thing, Atkins says another. Who do you believe?
And there are all kinds of drugs on the market as well.
And drugs on the market as well. Well, I mean, some people say it would be more fun to believe Atkins because, I mean, I'd love to be able to tell people that eating pork rinds and bacon and sausage is going to reverse heart disease, but it doesn't. And of course, Dr. Atkins has never published a single study anywhere about anything. And that's the whole point of science. These studies are hard to do. They're expensive. They take a lot of time and effort. But they're worth it because we can say clearly, using the most rigorous study designs and the most advanced technology, that if you're willing to make these changes, you're likely to get these outcomes. There are no guarantees, but in most cases, people get better when they make these changes. Now, if you came to see me as a patient, I wouldn't tell you to change your diet. I wouldn't tell you to quit smoking. I wouldn't tell you to take drugs. I wouldn't tell you to do anything. Because I've learned, I used to, but I learned that even more than being healthy, people want to feel free and in control. And as soon as I tell somebody, don't do this and don't do that and do this and do that, they immediately want to do the opposite.
So what do you tell me? I
would say, Mr. Rose, you've got heart disease, if you did. And you've got a range of options. Let's go through them together. We could find a good surgeon, a good interventional cardiologist to do an angioplasty. I could put you on statin drugs or other medications. You can change your diet and lifestyle. If you only make moderate changes in your diet, it's not going to do much, and we can talk about that. But if you're willing to make bigger changes, chances are you can avoid going on those drugs. Or if you need surgery, in most cases, you can avoid that as well. And then we go through the risks, the benefits, the cost, the side effects, and whatever you choose is okay with me. I don't have an agenda to get you to change, because if I do...
Including diet.
Including diet, because if I tell you to change your diet and you don't change it, then you're not, first of all, you're going to lie to me. You're not going to tell me the truth when you come back to see me, because you don't want to disappoint me. And then it's going to look like you're making changes and they aren't working.
But wait a minute. I mean, I suppose you were talking to me, and maybe I've done a little bit of reading, and you're going to say, well, if you've chosen a diet, I'm not going to try to dissuade you from that diet. And suppose I tell you that that diet is high in proteins and low in carbohydrates, and it doesn't care much about how much the fat intake is.
Right.
Are you going to say to me, you can walk out of this office without me reprimanding you about what I think is detrimental to your heart condition?
I'm going to tell you the scientific facts, but I'm not going to reprimand you. Because if I reprimand you and shame you, that's just going to make you want to do the opposite.
Poor choice of words on my part.
No, it's not actually. It's a very good choice of words, because that's what a lot of doctors do, and that's exactly what I was trained to do in my training, to say, you're not supposed to do that, you know, and that doesn't work. And that's why most doctors don't think their patients would make these changes.
So how do you get me to where you want me to be?
By not trying to get you to do anything. By just saying you're an adult, and you have a range of choices, and most people really don't know what their choices are. That's the problem. This report came out about a month ago that the National Cholesterol Education Program, panel of experts said, you know, everybody should be taking cholesterol, just about everybody should be taking cholesterol-lowering drugs. And they even said, you know, you can try diet first, but you might as well go ahead and add the drugs at the same time, because they know the diet they recommend doesn't do much. The diet that the American Heart Association recommends, the National Cholesterol Education Program recommends, they do wonderful work, but in this particular area, they don't go far enough. Now, moderate changes don't do much. We know that if you go on that diet, if you just eat less red meat and more fish and chicken, your cholesterol's not going to come down much. And so they say, well, we know that, so you might as well just add drugs at the beginning. What I say is, why not give people the full range of options?
Okay, suppose I come to you and say, look, I know about Lipitor and I know about Zocor, and I'm prepared, and I believe the results that they reduce my cholesterol.
They do.
How? And they do.
They do, sure.
But are you going to say to me, and it gets to the core, are you going to say to me, yes, that's a